My name is James Corbett. I'm with Eastern Idaho Public Health and I'm the Immunization Coordinator. And today we're going to talk about the ABCs of immunizations and why immunizations are so critically important to the health of you, your children, and the community as a whole. Vaccines prevent 2 to 3 million deaths each year around the world. If we continue to immunize and give our kids vaccines on schedule, we can help prevent these deaths and serious, potentially life-threatening diseases here locally. Heading into the 21st century, we need to continue to give our kids vaccines on schedule so that they are protected from these diseases. With infants, we like to follow a schedule that corresponds with well-child visits with your pediatrician or family doctor. 2, 4, 6, 12, and 18 months will provide the adequate protection to keep your kids safe from these vaccine-preventable diseases. Generally, when kids enter kindergarten, they'll receive a few booster vaccines for tetanus, measles, chickenpox, and polio. Entering 7th grade, we recommend vaccines to help boost protection against pertussis, bacterial meningitis, and reduce the risk of cervical cancer. College students should get a booster for the bacterial meningitis. And as we enter into adulthood, we still need to be cognizant or remember our tetanus boosters and are getting our flu vaccine every year. As we get the flu vaccine, we help protect ourselves and those around us from this potentially life-threatening disease. As you travel outside the country, there may be other vaccines that can help you against diseases that are uncommon to this area. Check with the health department or with your healthcare provider if you have questions. One of the common fears we hear from parents came from a study in the late 90s from a physician in England about MMR, or measles, mumps, and rubella, and autism. He has since lost his license and can no longer practice medicine because it was found that he falsified that research. Many studies have been done since then with absolutely no link between vaccines and autism. A second common fear we hear is wondering if our children can handle all these vaccines at once. Our bodies are exposed to millions of germs each day, and our bodies handle these exceptionally well. Vaccines are a very small portion of what our body can handle. Another misconception or fear that we hear is the vaccine can give me the disease. There's 2 different kinds of vaccines, inactivated versus live, and neither one can give you the disease. The flu vaccine is the one that we hear this most about, that somebody came down with the flu from the flu vaccine. This is not true. You can't get the flu from the flu vaccine. However, vaccines can cause minor side effects, but they generally resolve quickly. If you have questions, concerns, or are wondering about your immunization status, contact Eastern Idaho Public Health or your healthcare provider.